Hi everyone. We have a case of a 56-year-old female who gives history of coughs in 6 weeks. The cough is non-productive in nature without any expectoration, and she denies any other history of respiratory symptoms like dyspnea, chest pain, hemoptysis. She also denies a history of any constitutional symptoms like fever, loss of weight, or loss of appetite. Upon asking regarding the GERD symptoms like frequent throat irritation or foreign body sensation in the throat, retrosternal burning, she denies all of these history of the GERD symptoms. And for these symptoms, she has shown to multiple clinics for this dry cough, and she has been treated with IV antibiotics, oral antibiotics, IV and oral steroids, nebulized bronchodilators, inhaled corticosteroids, proton pump inhibitor, but she did not give any improvement. She did not see any improvement with these treatment. When she came to us, she was completely fine. Her vitals were completely normal. On examination also, there were no positive findings on auscultation or any other examination finding. And on investigations, the complete blood cell count were completely normal, and the chest X-ray also was completely normal. There were no evidence of any pneumonia or parenchymal or a pleural abnormality. So we thought of dwelling more into the past history, and when we asked about her recent past, she gives history that she was recently diagnosed with hypertension, systemic hypertension and dyslipidemia around 2 months before, and she was started on Ramipril and Atorvastatin. So the question was, which is the next best step in evaluation of this patient? So by seeing her history and examination finding, the most appropriate step here is to stop Ramipril, which is an ACE inhibitor, and you have to switch over to an alternative antihypertensive. So this is a classical case of drug-induced cough, where we don't have any other symptoms which are suggestive of other causes of chronic cough. And examination findings and blood investigations were also completely within normal limit. So there is no chance of going for further evaluation. Rather than that, the very important point that initiation of the ACE inhibitor and the onset of symptoms, they correlate. So the best step will be to stop that ACE inhibitor and replace it with any alternative hypertensive, because ACE inhibitors, they contribute to around 5 to 20% of drug-induced cough. And mainly the mechanism is because of accumulation of bradykinin and substance P in the airway, which is leading to dry cough. And that's why she did not have any improvement with the conservative management of oral and IV antibiotic or IV steroid. So once we had stopped the ACE inhibitor and replaced it with any other alternative antihypertensive, she showed drastic improvement. The cough has subsided, and after that she didn't had any similar episode of cough. So this case highlights you have to take an extensive history before going for further evaluation with the higher modalities. Thank you very much.